This week is Black Maternal Health Week. Organisations and public health agencies nationwide are working to bring awareness to improving health outcomes for mothers, but especially black women. Black women are 3 times more likely to die from pregnancy-related causes than white women, and according to the CDC, disparity in the rate of black maternal deaths is still seen in the most recent data. And joining me now is family physician and health advocate Dr. Bayo Curry-Winchell. Thank you so much, Dr. Bayo, for being here. What do people not realise about black maternal health?
They don't realize that this goes beyond access. This impacts black women across all social economics. It doesn't matter about your education, where you live, your profession. You have a higher risk of dying giving birth.
So, I mean, that is pretty shocking just to hear that you say those words, and it's more than just data, or it's actually kind of a reality for people. You say there are 3 C's every black woman should know to take charge of their health. So break that down.
Yes, there are 3 C's: being clear, concise, and confident. We've all had the experience where you go to the doctor and all of a sudden your questions just vanish and you're like, what just happened? Because you're intimidated or anxious. But if you can be clear about your symptoms, instead of saying, I don't feel well, instead say, I have stomach pain. It's been present for 3 days and it hurts after I eat. That can really help paint a full picture for your doctor. The other thing is being concise. All of us have experienced the 15 minutes, you might be lucky and get 20 minutes with your doctor. And so if you can lead with your most pressing questions and say, these are the key symptoms I would like to get answered, that can be a great way to advocate for yourself. And last but not least, be confident. You know your body best. And so be able to advocate and ask questions. All 3 of those allow you to be what I call your chief medical officer. So every time you seek care, you can get the best care possible.
That's really great advice. In the UK, by the way, it's 8 minutes you get with your doctor. I mean, even less. What do health professionals need to do to try to close this gap? Because it's pretty radical.
They need to set aside their assumptions and genuinely listen to their patients, because when you do that, you're able to really lean into individualized care. So thinking about setting aside those assumptions, leaning into that patient in front of you, and think about how hard it was just to even possibly see you, that's going to allow you to give the best care possible and really make sure your patient is seen, heard, and that way you can give that quality of care.
Thank you so much for coming in and raising awareness. This is really, really an important issue. Thank you. Family physician and health advocate, Dr. Bayo Curry-Winchell.